Hannah, and I'm going to be giving an intramuscular injection, Z-tracking and site finding of ventral gluteal site. So in the med room, I'm going to prepare my medication, getting it from a vial. I'm going to perform hand hygiene. I've done my 5 rights, my 3 checks, hand hygiene, and then I would open my new vial by taking the plastic cap off, throwing it away. Then I need to cleanse the top of the vial, or the rubber stop. With an alcohol swab, throw it away. I need to inject air into my vial to not create a vacuum. I'm going to be injecting the same amount that I'm going to be taking out. So this is an IM injection, so 1 to 4 mils. And I have a 22 gauge needle that's 1.5 inches. When you inject the air, you have to inject it above the solution. And then you invert the vial. And then you only touching the plunger. Withdraw how much you need, or a little bit more. And then you remove the needle. Time and date on your vial, multi-dose vial. And then you remove air bubbles and obtain the appropriate dosage of your medication. And then you have to bring this into your patient's room, so you need to recap it. Scoop method. Then you enter the patient's room. When you're in the patient's room, provide privacy, allergy check, 5 rights. We did our 3 checks. Perform hand hygiene. Put on gloves and locate the ventral gluteal position of your patient. Ask them to roll over onto their side. Expose the area. You're going to be putting the palm of your hand on the greater trochanter, your index finger on the anterior superior iliac spine, your middle finger on the iliac crest, and then in between those 2 fingers is where you're going to be administering the medication. So when you administer the medication, you need to make sure to cleanse the area in a circular motion from inside out, letting it dry, discarding an alcohol swab, and we're going to be Z-tracking. So remove the cap from the needle, the non-dominant hand, displace the skin 1 inch, and you're going to inject at a 90-degree angle with a dart-like motion, and then administer the medication 10 seconds per mil. And after you've fully administered the medication, you're going to remove the needle quickly and release the skin at the same time. At this point, you can gently apply pressure to the injection site. Careful not to massage the area. Discard that, and then you would throw away your needle in the sharps container. After that, you're going to document, or you can remove your gloves, perform hand hygiene, and document the administration of the medication. And then you're going to evaluate the patient's response, and then you're done.